Hi friends, I'm Dr. Vandi MS. Today I'm going to share with you regarding the topic the rise in TB deaths for the first time in over a decade reported by WHO. Before going to today's topic proper, let me remind you all one thing that if anybody watching this video not yet subscribe my channel, please do subscribe and press the bell icon so that you will get all videos related to recent advances in medical field and public health that I'll upload in this channel. So coming on to today's topic. Under these main headings, I'm going to share with you today what are the TB facts according to WHO and TB deaths rise due to COVID-19 pandemic and what are the reasons for increasing deaths due to tuberculosis during COVID-19 pandemic and what are the global TB targets and global TB targets off track, that is where we have reached right now. These are the things I'm going to share with you today. Coming on to tuberculosis facts, according to WHO, tuberculosis is the second after COVID-19 deadliest infectious killer is caused by bacteria that most often affect the lungs. It can spread when people who are sick with TB expel bacteria into the air, for example, during coughing, sneezing, laughing, etc. Approximately 90% of those who fall sick with TB each year live in 30 countries according to WHO, and most people who develop the disease are adults. And in 2020, the men accounted for 56% of all TB cases, and adult women about 33%, and children 11%. And many new cases of TB are attributable to 5 risk factors such as undernutrition, HIV infection, alcohol use disorders, smoking, and diabetes. And most interesting thing is that TB is both preventable and curable. About 85% of people who develop TB disease can be successfully treated with a 6-month drug regimen, and treatment has the added benefit of curtailing onward transmission of infection according to WHO. These are the 30 countries with the highest burden of TB, which includes India too. The TB deaths rise for the first time in more than a decade due to COVID-19 pandemic reported by WHO. According to 2021 Global TB report released recently, TB deaths have increased. And India, about 41% was on the list of countries which topped those that contributed most to the global reduction in TB notifications between 2019 and 2020. And India, along with Indonesia, that is 14% reported reduction in notification, and Philippines 12%, China 8%, and 12 other countries accounted for 93% of total global drop in notifications. And reduction in provision of TB preventive treatment also reported by WHO among these 330 countries. And about 2.8 million people accessed TB preventive treatment in 2020, a 21% reduction noticed since 2019. The number of people treated for drug-resistant TB fell by 15% from 1,77,000 in 2019 to 1,50,000 in 2020, which is equivalent to only about 1 in 3 of those in need. WHO estimated that about 4.1 million people currently suffer from TB but had not been diagnosed with the disease or had not officially reported to national authorities. This figure is up from 2.9 million in 2019. This is one of the alarming things right now. In 2020, more people died from TB, with far fewer people being diagnosed and treated or provided with TB preventive treatment compared with 2019, and overall spending on essential TB services falling. About 1.5 million people died from TB in 2020, which includes to 2,14,000 among HIV positive people. The increase in number of TB deaths occurred mainly in 30 countries with the highest burden of disease. And why deaths is increasing right now? There are two main challenges are there. Number one is disruption in access to TB services and a reduction in resources. That is, in many countries, human, financial, and other resources had been reallocated from tackling TB to the COVID-19 response, limiting the availability of essential services. Second challenge is people had struggled to seek care in the context of lockdowns. These are the two main reasons for raising deaths due to tuberculosis due to COVID-19. And according to WHO Director General, that is Tedros Adhanom Ghebreyesus, he said that this is alarming news that must serve as a global wake-up call to urgent need for investment and innovation to close the gaps in diagnosis, treatment, and care for the millions of people affected by this ancient but preventable and treatable disease. These are the global targets. In 2015, all member states of WHO and the United Nations adopted the United Nations SDGs and WHO's NTB strategy. The SDGs and NTB strategy both include targets and milestones for large reductions in TB incidence and TB deaths and costs, that is catastrophic costs faced by TB patients and their households. The WHO NTB strategy aims for 90% reduction in TB deaths and 80% reduction in the TB incidence by 2030 compared to the 2015 baseline. And the milestones for 2020 include a 20% reduction in TB incidence and a 35% reduction in TB deaths. And also, United Nations Political Declaration TB included four new targets for the period 2018 to 2022. That is, treat 40 million people for TB disease, reach at least 30 million people with TB preventive treatment for a latent TB infection, mobilize at least $13 billion annually for universal access to TB diagnosis, treatment, and care, mobilize at least $2 billion annually for TB research. These are the four new targets by the United Nations Political Declaration TB that has to be achieved by 2022. And now we can look for where we've reached right now. That is global TB targets off track. That is reversal in progress. Reversal in progress means that the global TB targets are off track and appear increasingly out of reach. Globally, the reduction in number of TB deaths between 2015 and 2020 was only 9.2%, that is about one quarter of the way to the 2020 milestone of 35%. And also globally, the number of people falling ill with TB each year dropped 11% from 2015 to 2020, just over halfway to the 2020 milestone of 20%. So these are all things for today. Thank you all for watching my video. If you like this video, please share with your friends and also subscribe my channel so that you will get all videos related to recent advances in medical field and in public health that I'll upload in this channel. So thank you all for watching. Thank you.